At first, the priority and the dream was about making sure that no patient was ever turned away from our organization.
Thousands of patients over the last 5 or 6 years that we haven't been able to treat.
We knew that as an essential healthcare provider in our state, as a statewide system, these facilities were needed and we uniquely could utilize them.
It is challenging to work in a hospital where you're 105% occupied every day.
We needed beds because we've been since 2014 up above 95% occupancy pretty much every week.
It was really driven by the fact that we were growing at such a pace that it was ending up that we were turning patients away. And that was devastating to, I think, the individuals who work here, the patients who came to us, and myself personally.
And I hate seeing patients go out of state for things that we could provide them here if we had the capacity.
This is not just another hospital expansion. This expansion is about Oklahomans and keeping people here that are care flighted from Duncan. Because the patients that come to this hospital can't go other places in our city and our state to get the care of a level 1 trauma center or comprehensive cancer surgical procedure.
Over the past several years, 6 rural hospitals across Oklahoma have closed. That is not only devastating for the local economy in those communities, but it's even more devastating for people that live in those communities and need care.
I went around and talked to all the rural hospital CEOs and asked them what the University of Oklahoma Medical Center served for them and what they needed from us. And they said, don't shut your doors. Don't ever shut your doors, because when we need you, we need you. That was the intent of all this added capacity. More and more patients can come here, and ambulances will never be turned away. And we want to make sure that we can open the door every time and serve.
We have strived to become a world-class facility, world-class center for patient care.
We broke ground even before OU Medicine became a nonprofit. We were confident, even with the additional milestones that we had to do before February 1st of 2018. We knew this building was needed. We were confident in our team and our path.
Dreaming big is buying out a corporate giant and creating your own company. And the people that led the trust, namely Mike Samus and Dean Gandy, Jason is on the trust board, and now Randy Dowell, they have been a part of the will and effort to get us here. They all bet that this was something that could be done, should be done, and could be executed upon effectively, and I thank them for taking that chance.
Why is this bed tower important? It's important because it provides that space, it provides that area, it provides the location where all of it comes together, where the magic of a truly great comprehensive academic health system takes place. That's what this bed tower is.
We're going to be using the new space to allow us to expand our research team so we can increase our clinical trials into the inpatient setting and bring the newest and most innovative inpatient therapies to the cancer patients of Oklahoma.
We needed to move away from 1975. We've got generations of innovation, of technology that's occurred. Those ORs weren't built to teach and train residents and fellows. They weren't built for robotics. They weren't built for the things that we're now doing.
We're really excited to be opening the tower and to start this next chapter of our organization's life, to share our mission and use their philanthropic gifts to advance that mission.
I think it's exactly why OU Health was created. We're taking the future of this campus into our own hands.